Thank you for joining my webinar here this morning. Wanted to talk a little bit about musculoskeletal pain and how we can do a better job at managing musculoskeletal pain and the cost associated with it. As noted, I am a physical therapist. I spent the first several years of my career treating people with general musculoskeletal issues, everything from chronic low back pain to neck pain, even post-injury for things like ACL tears, rotator cuff issues as well. And one of the things that really struck me is that most of the injuries that I treated, frankly, could have been prevented had someone intervened earlier in the cascade of the injury. And so what I want to focus on today is talking a lot about how with simple techniques, we can identify the precursors of musculoskeletal pain prior to them becoming major significant issues. So there's no doubt musculoskeletal pain is a huge issue across the country today, with 1.7 billion people worldwide having some type of musculoskeletal pain. And as we know, at least I know, that increases the prevalence of musculoskeletal pain, certainly increases with age. And oftentimes with age, what we find is that people just, they tolerate minor discomforts and aches and pains. It's normal for the aging process. And that's a big area I want to focus on here today. We also know that people that have musculoskeletal pain often have many comorbidities. And what I mean by comorbidities is potentially diabetes, hypertension, chronic heart disease. And you know, we can often say which came first, the musculoskeletal pain or the other comorbidities. But what we know is that in conjunction together, they have a negative impact on each other. So let's think about the individual who maybe has gained some weight as they've aged. And so walking and exercising is uncomfortable and frankly painful, so they stop doing that, which then cascades into gaining more weight, hypertension, heart disease, and you get the idea. Things just continue to go in the wrong direction. So really important to tackle the musculoskeletal pain and discomfort. Looking here on the list of items, also 8 to 10 people will experience back pain. I'm shocked it's only 8 out of 10 because what my non-scientific review is that most everyone at some point in their life has low back pain. Lack of exercise is certainly a contributor to musculoskeletal pain, and from a health benefit plan standpoint, musculoskeletal pain really does hit in one of the top 5 cost contributors. So let's think about how musculoskeletal pain comes up for most people, right? So we've got Steve, the accountant here, who's now working from home still. He's 44 years old. He's been an accountant for 20 years. He has 2 kids. He loves soccer, coaching the kids. He likes to play softball, and he's just had some general low back pain. And really, as you read through the episode here, he noticed about 2 years ago that back was just tight, wasn't sleeping well. Sometimes he would attribute the pain and discomfort to sitting too long, or even sitting on a couch, as it shows here, when he's been working virtually. And it's just getting more and more persistent. 3 days ago, Steve's back goes out. He's helping a friend move a piece of furniture, and now he's in significant pain. So what does Steve do? Well, you know, unfortunately, many people at this case find themselves going to places like ER or urgent cares. What we know about that is that they're extremely expensive. And they're very focused on a quick treatment that will allow the pain and discomfort to subside. Now, the pain and discomfort may subside, but the condition is still there, right? They may at the emergency room say, you know what, here's something to take care of the pain now, but we want you to go see an orthopedist. The orthopedist does, more imaging, MRIs, CAT scans to determine, is there something more serious going on? Then there's follow-up, then there's physical therapy. And in this case, this event here, you may not even get into physical therapy for 2 to 3 weeks after the episode of the back going out. Cumulative cost over $13,000. And yet, if you look at this cascade of treatment, what you notice is that no one has really gone back and had the discussion with Steve about what started all this, right? What was the first episode like? When did you notice low back pain? And when is it the worst? What are you doing at home that might be contributing? So early detection, right? This is where, after years and years of treating patients as a physical therapist, 100% of my career today is focused on educating people about early detection and what you can do to eliminate low back pain or any other type of musculoskeletal pain, just by asking some of the right questions. So 75% of general musculoskeletal pain, at least 75%, can be treated through conservative care. What do I mean by conservative care? I'm talking about things like physical therapy, stretching, education. And so let's really talk about that. Those early precursors of pain and discomfort, tightness, weakness, postural deficits, those are cues that something needs to be done differently. Checking here, I think I have. Okay, sorry about that. We're all working through communications here. But the postural deficits, as you see in this graphic, they do happen gradually. And it's interesting to maybe look at somebody who's in that 60 age bracket, and you look at that posture, and if you were to ask that individual, when did your posture start to change? They would probably likely say, what do you mean start to change? Because we don't even realize what our own bodies are doing and how things are shifting. And so when we look at the correct postural stance with shoulders back, head high, ears over the shoulders, and then you look at someone who's sitting at a workplace with a slouched shoulder, forward head, rounded shoulders. What we know about those positions is those can lead to significant neck issues as well as shoulder and upper back issues. So really important to start asking questions around pain and discomfort. Does it hurt to raise your arm above 90 degrees? And if someone says, well, yeah, of course it does. I played softball for years. So anytime I'm doing something overhead, it's just sore, it's uncomfortable. Well, it's not supposed to be that way. And more than likely, if we ask the right questions, we're going to find that is largely contributed to posture and upper thoracic area strength. So if we can detect the early discomfort, we can apply the right techniques to reduce those discomforts so that shoulder pain does not feed into rotator cuff tears or other issues. And what do I mean by early detection? Well, we use a virtual platform, as you can see on the bottom, where our staff members can engage with employees in whatever workspace they're in, whether that's virtually at home, such as where I'm working currently, or it's in an office setting. We can also look at it there, look at their workspace there. But there's no question that it starts with asking questions. And, many times as we engage with employees and talk to employers about going into their workspace, we tell the employers, we want to ask people, how do you feel? Do you have any discomfort, any pain? What's going on with you? And at times employers say, that's scary because I don't want my comp claims to go up. I don't want recordables or whatever that may be in your area of the world. But the reality is if we can find someone who says, my hips hurt at night when I'm laying on my side. Okay, well, that's good. Is that something we need to send you to a surgeon for today? No, but it's telling me that something's going on with your body, right? It's telling me that there's likely a weakness or there's a tightness, a muscular tightness that is impacting your hips. And it could be the way you're sleeping. It could be that your bed is too old. It could be that your bed is too soft. But there's all of those questions need to be asked to understand what really is the precursor to the discomfort in the hips in this particular example. So asking questions and assess, looking for the high risk postures, looking at their setup. So, asking them to, with their camera, show me your setup. Do are your monitors at the right height? Do you have the right type of chair? Is it adjusted properly for you? And really, oftentimes what I find, particularly when I'm looking at office assessments, is that it's not the lack of need of equipment. It's the inappropriate setup of the equipment that you have. And so talking to people about, hey, your chair looks like you need to raise your chair at least another 2 to 3 inches. That may mean that you need to get something to put your feet up on because we don't want your feet dangling. Your feet should be flat on the floor when you're sitting in your desk. We want to make sure that your chair supports you. And in this picture that you see this gentleman working at his table, you notice that the back of the chair, his back's not even touching the back of the chair. And so oftentimes I tell folks, look, if you're going to sit like that, why not just use a stool? Because the back of the chair is there for a reason. It needs to support you. It needs to give you support in the right area. You can also look at it the other way. If someone has a good office chair, but it is set to allow them to recline, and that's in fact what they do, then you can have as many issues there as you can with someone who's not even using the back of their chair. We need to take a look at what we see in our assessment, ask them to stand up, get a full body view of their posture. Are their shoulders in good positions? Is their back in the right position? Are they in a forward slouched position? And then even go through range of motion assessments. Can they get their arms up over their head? If you notice that they get to about one position and they just can't go any further, well, already I can tell you that is an indication of some sort of an impingement syndrome in the shoulder. And we've got to figure out what's going on there, because chronic impingement of the shoulder is what leads to the degradation of the rotator cuff musculature, which of course is a very expensive injury and a very painful injury for people to go through. We oftentimes look at things with people that have musculoskeletal discomfort and find that, their treatment is simply ibuprofen or an over-the-counter anti-inflammatory, and they don't look at using ice or heat, which can both be very effective for musculoskeletal issues. I'm a big advocate of ice. Ice helps reduce inflammation. Although some people say, well, if you have inflammation, that's your body reacting to a problem, and getting more blood flow to the area helps the tissue heal. So inflammation to the extreme is what we want to prevent. So inflammation, significant swelling where the joint's unable to even go through the full range of motion. We want to apply ice. We want to make sure that ice is on for 10 to 15 minutes. And it gets truly to the point where it's numb, not just something that it's just kind of chilly or cool on the body. In the same fashion, heat can really increase mobility. So, using the heat pack, taking a hot shower before your day begins to help get you loosened up. Critical after using any kind of heat is to make sure you go through the range of motion, make sure that you're moving and can get the blood flow to the area and get yourself stretched out. For those of you lucky enough to have things like hot tubs or tubs that have spa jets in them, or even just as I mentioned earlier, a nice hot shower first thing in the morning is a great way to start the day to get everything loosened up and get you started to go through activities. When we talk about stretching, there's static stretching and there's dynamic stretching. Both can be beneficial. But what is critical about the stretching is to make sure that you're going through the stretch in the right manner. I'm going to give you one example here. We hear a lot about, with office workers, we hear a lot about carpal tunnel, right? That, or epicondylitis even. Epicondylitis is the pain right here on the outside of the elbow. And so when you look at this kind of discomfort, it's sometimes because of the positions of the wrist while they're using their keypads. But if you're having discomfort right in this area, sometimes called tennis elbow, one of the stretches that is often given is this stretch right here. Well, if you have, and that's a good stretch, if you can feel the stretch at this joint. It's a great stretch unless you are a very hypermobile person, typically females, because what happens with that stretch, with that group, that population, is that their stretch here is taking it to the in range of motion for their wrist. So they're really compressing the wrist joint before they ever get to a stretch at this area right here. So they're causing damage over time to the wrist joint. So what we do in a case like that is we'll tell the person to just lightly make a fist and now do the stretch, and that will significantly increase that stretch at that joint. But I use that example because I want people to understand that, doing a stretch in the right way is critical. And there are many times where I observe people when they're doing certain stretches that they're actually potentially causing more discomfort or more potential damage than they are taking care of things and doing it right. So, how do you deal with that? One of the things that I think is a huge benefit, whether it's physiotherapist, depending on the area of the world you're in, or physical therapist, is allowing that population, could be athletic trainers, allowing that population to really help set you up for success. And that's why when we look at minor discomfort, general pain, and really highly recommend those people seek conservative care early. Our data is showing through physical therapy, if you seek physical therapy early, you're going to see, as stated earlier, 75 to 80% of the discomfort is going to be taken care of without ever having to seek out higher levels of care that are typically much more costly. So instead of going to an orthopedist who is first going to rule out anything else significant, such as a disc, or it could be a compression of a nerve or a tear in the ligaments. They're gonna run those tests just to make sure those things are ruled out. When in reality, if you had sought care through a physical therapist early on, through their screening techniques, would detect whether or not this is just general musculoskeletal issues that we can take care of, or yes, you do in fact need to go and seek a different level of care. So assessments are critical. Asking the question, helping people to understand that discomfort and pain is not normal. It's your body telling you that something is not right, and that's critical to listen to your body. It's critical to understand before you then do one traumatic thing, such as Steve did in our presentation earlier on in the presentation, where he lifted something and his back was in such a condition that it just couldn't handle that stress, went into spasm. Now his back is out and unable to enjoy life. So assessing people, look for the high-risk positions, and then based on what you see, prescribe an assessment. The video chat is a great way to work with people who are working from home. One of the things we've absolutely noticed through the pandemic is that people have not sought medical care early enough. And so where maybe they would have been more apt to go to a physician with minor discomfort and pain before the pandemic hit, they're just tolerating it now because people are trying to avoid extra visits where they don't have to be exposed to other people. The video chat really can provide a lot of input if the person on the other end, as noted here, is a trained, qualified individual to assess what's going on with the individual's body. So we love to use our terminology, certified early intervention specialist, which again is anything from a physical therapist to an athletic trainer. Love to use that as a method to help do the assessment and then prescribe exercises as appropriate. With that, I'm going to turn the presentation over to my counterparts at Cardinus, Bill Pace and Andy Furlong. I am happy to take any questions as well. And so maybe let's do that and see if there are any questions out there. Anybody wants to raise their hand and I can respond to that. Okay. Well, Bill and Andy, it doesn't appear that I have any questions coming in. Would you like to take the video here? I believe do I need to leave the video, turn off my monitor, and Bill, you'll be able to turn yours on?
I believe so, Sheila. Let's give it a try.
All right. Okay.
All right. Well, I think we did it. Sheila, thank you so much. I just absolutely appreciate your wealth of knowledge and experience in bringing this all together for everyone to have a better understanding of. And I think it's important to note too, from our perspective, that the partnership we have with ATI is absolutely fantastic. And the reality is we really do align ourselves with the idea of improving and saving lives. And I hope that's what you're really going to take out of this is there are return on investment numbers that we'll go through and talk about. But I mean, ultimately, it's about doing the right thing, right? And that is improving and saving lives. And by doing that, you are going to positively impact your bottom line. And the relationship we have with ATI, the partnership we have with ATI, as you're about to see, is really helped us not just do that, but expand our portfolio so we can go into other areas of business to do just that, improve and save lives. So Sheila, thank you. Thank you very much. Good morning, good afternoon, everybody. I am not John Abbott. As you can see, coffee is my best friend this morning. I've been asked to jump in, though we've had some technical issues and difficulties, but that's the reality of the COVID world, as we all know right now. So without further ado, let me just go ahead and get started. Clearly, there's a slight delay. Ultimately, we've been known as a office-based organization in the US, the office meaning office ergonomics. And then through the rest of the world, EMEA, APAC, there's so many other things that we've been able to do. But today, what I really want to focus on is helping you with either regulatory compliance in a nationalized medicine world, or for reducing in workers' compensation or healthcare costs, and even improving lost time and productivity. So years ago, I had a discussion with a large brokerage group here out of Texas that's in 13 different states. And I was helping them with their clients that were self-insured on the workers' comp side. And as we had these discussions about getting ahead of everything that Sheila just talked about, getting ahead of MSD, understanding when employees are experiencing discomfort, not just in the sense that discomfort's your body's way of telling you you need to move, because we want that, right? We want to educate them that way. But as Sheila had also mentioned, discomfort can also be that barrier for movement. It can be so strong that the employee is avoiding different movements or different postures, which just kind of triggers that snowball. And as we were talking to them, I got brought into the healthcare side of this brokerage, and we started talking to the VP of health insurance with the idea of looking into their data. Now, this is 7 years ago. And when they looked at their data, when they went back and looked at the loss runs, what they found on the healthcare side was MSD, MSK was number one, not just in frequency, but also in cost. It had surpassed some of the other comorbidities that we always think about on the health insurance side. The cancer, the heart, the diabetes, the things that we naturally think are number one. And it really opened their minds to the idea that, as Sheila talked about, we're dealing with cumulative trauma, right? So employees sometimes don't know where this is coming from. So in the US, they tend to use the health insurance card to take care of this. In the UK, EMEA, and others, they still go to national medicine to find help, to find relief from this discomfort. So in my mind, in our eyes, it doesn't matter if these healthcare costs are being covered or not, because the ultimate is your employees are probably going to go see the doctor, the medical provider, the PT, the chiropractor during workday hours, right? Because most of those are open 9 to 5. And that means they're generally taking a half a day to a full day off. And what we found when we further looked at this data was that 60% of the employees that were experiencing high discomfort in 2 or more body parts were seeing a medical professional on a monthly basis and taking the whole day off to see them. That's 12 days of absenteeism that absolutely could be avoided. And I think that that's important, because to us, it doesn't matter if it's nationalized medicine or if it's privatized medicine that we have here in the US. So what does that mean, and what helps? And ultimately, it helps to put the power of the employee's wellness and well-being into their hands, educating them as to the why so they remember the how, right? Educating them that discomfort's their body's way of telling them it's time to move. Educating them that if discomfort is a barrier, let's take care of this before it becomes a sprain, strain, tear, or rupture, right? Before it becomes a much larger issue. And ultimately, it doesn't really matter if that's a workers' comp or a health insurance issue, if in fact that employee's out of the office dealing with surgery or out, using their sick time or their PTO because they can't come into the office because of the strain, tear, rupture. I know, Stephen, we just had someone raise the hand. So is it something that you want me to address now, or should we wait? I don't see any questions. Do you mind if we use the chat feature, and I can address the questions as you raise your hand in the Q&A session? I don't know if that was covered or not. So providing the employees e-learning first and foremost really helps them with posture, with positioning of equipment, with allowing them to understand what neutral posture is. And sometimes even giving them that advice or helping them with equipment, it actually increases discomfort, right? Because if I've been slouched for long periods of time over and over for the past couple of years, sitting upright might actually be uncomfortable. Sitting with slightly leaned back in a 90 to 110 degree position, even though I'm fully supported, it might not be something that I can do for long periods of time. So reversing that muscle memory is really important. And in doing that is providing them the why. And I think that's the importance of the e-learning process. But it also helps them self-identify, right? It also helps them see where their posture or their positioning is out of alignment and starting to make those corrections. And then as we take them through the self-assessment process, it allows them to do the same thing, right? It still continues to reinforce based on the images, based on the way that they're addressing the questions with their answers, they recognizing again that they still need to make changes. So ultimately what we want to do is get them all the way down to the step 4, right? That these are the people, maybe the 10 to 12% or the 6 to 8% that really need further help. And I think that's extremely important to understand and to know. And as I jump out of this real quick, I do want to demonstrate that in this COVID world, in this pandemic world, things have changed. It's not just about helping the employee with their posture and positioning. It's also about understanding, what their equipment is that might be outside the norm. And in this case, it's employees working off a tablet. It doesn't exactly put them into the category of the majority of the employees that are using a keyboard and mouse and a monitor, right? They are now actively having their elbows in front of them, maybe even looking down at the screen. So your head and neck go where your eyes go, having your hands above your belly button, above your chest, at times even to work. So all of that is important to identify and to provide relief when you can. So training the employees on proper use of the tablet's important. Even going so far as to adding avatars of the company's culture, so they recognize this as their own program. And I think that's another important piece to all of this, is not just using the e-learning as a means of upholding your policies and procedures and safety and ergonomics, but also representing your culture. So the employees see it not just as your program, but as something that fits within your narrative and fits within the scope of your organization. One of the other things that we started looking at is employees with disabilities, because as we found with working with one of our global banks, is they wanted to understand, are there mental concerns that we need to be aware of? Are there employees that are in wheelchairs that we're not aware of, or that we need to give better help? And in the UK, we really, in EMEA, we call that signposting. And so this even applies in America for the American Disability Act, is starting to look at the employees that have disabilities that have different needs for training, right? As we say, if an employee were to click on the profile down in the lower left-hand corner, as you can see, there's an employee in a wheelchair. If they were to click on that, what we generally do is signpost them to EH&S or to HR, because there's no sense giving them training on a sit-stand desk or on a 5-caster chair if in fact they're bound to their wheelchair. So it's better to give them even more appropriate training, more focused training. But it's also important for most of our clients to know, where are these employees and how can we best help them? And especially now in America, as we return to work, it's important to understand and identify these employees as well. And then, as one of the things that I do want to show you is understanding, the stressors, the things that are important in making sure that the employees that we are improving and saving lives. And as we do that, at Cardinus, we're able to build course hubs for your employees. In this case, this is our parent company that we were looking at providing remote employee or temporary work from home, plus the return to work course, all bundled as one, and also with healthy working. But they were having some issues with slips, trips, and falls. They were having issues with material handling, manual handling. So we wanted to provide them very focused training to improve lives and prevent injury. And these were where they saw their biggest issues were in these areas. So we provided these courses for them under one hub. And the beautiful part about it then is it all goes into one database. It all goes into one reporting system. And here's another one that we built for our parent company where they wanted mental health awareness. And I think that's one of the most amazing things that's coming out of COVID right now is the idea that companies, because employees are working from home, organizations are looking at ways to help improve the employees' lives, whether it's training them on balance or helping them as Sheila had talked about with sleep. But ultimately, it's even more than that, right? Is where are your stressors? What is going on in your life that's preventing you from getting your job done? And because you can't walk by Bill Pace's desk and find out what Bill's doing today and how he's feeling and giving off nonverbal clues, it's really important that we find other ways to assess the employees. And that's really what we're seeing out of that mental health awareness. And that's, what I was going to say with the pandemic. One of the beautiful parts about it is more and more organizations are looking for ways to help the employees when it comes to mental health, when it comes to stress, where before the pandemic hit, I would say that most organizations didn't want to open that box. They did not want to open Pandora's box. But now they realize that it's extremely important, especially with employees working from home, that we find ways to assess them and we find ways to provide mental health solutions for them as well. As we kind of move into the next round of the presentation, it's really about, what does it mean for global organizations to find help with virtual assessments? We absolutely partner with ATI to provide virtual assessments in the US. And in this case, I want to talk about rest of world, where we help organizations in over 142 different countries with local language as well. And I think that's extremely important because we have employees working all over the world and remotely now, right? So they absolutely need help. And it's important that you realize that, we do uphold certain criteria in making sure that they have the right certifications, the right background to provide those assessments for your employees. And as we kind of move into the return on investment, I think it's important to see, why the e-learning, why we stress that so much and we do have clients, right, that say, hey, we just want the employees to be assessed. We don't want them to go through e-learning. We want them to be assessed. So you can see if we're just offering the employees an assessment, if we did this for this mining company, this is what their fees would be, just in assessments on a global basis. And it's looking at a very value-based assessment at $99.56 US, right? But they decided that they wanted to have the employees to go through e-learning, right? Provide them with the ability for self-help, but make them a bit more accountable for their well-being, for their wellness. And what we found is we were able to reduce the employees that were in discomfort significantly to the point where their current high and mid-risk assessments and fees had dropped down to $49,000. So in this case, we saved them well over $500,000 by providing the employees the e-learning and the ability to help themselves. And I think that's important as well, because they can always go back to that e-learning for follow-up help, for follow-up training, for things that they may have forgotten about, especially, as Sheila mentioned, especially as they start feeling discomfort. And then here we have another example of a global organization. They're gaming, there's a lot that's going on there. Significant savings in providing the employees e-learning and a full self-assessment before they were actually able to go into a telephonic assessment. And what we're also realizing is in building our healthy working program is that, we have two different forms of employees that are at home, right? We have the employees that are home that have a desk and chair, and then we have the employees at home that do not have a desk and chair. And so it's important that we offer them very, very different training and specific training based on whether they're working off the coffee table, the kitchen counter, the sofa, versus having much more of an ergonomic setup in a company supplied desk and chair. So it's important that not only we understand that, but the assessors understand it as well. And lastly, in conjunction with ATI, we slowed down over the past year to really provide a much more comprehensive solution. And with ATI's help, we've built an industrial program. Again, we wanted to really kind of keep things simple. We wanted to use the KISS principle. There's a lot of different programs out there. There's video capture. There's so many things that are happening in this world. And we recognize that one of the things that we wanted to take advantage of is making sure that we were actually providing a program that was easy to use. In other words, we wanted to make sure that we provided a program that had all, I would like to say all, that's not the right word, right? That has 22 different validated risk assessments, risk measures. And so in our drop-down field, it gives your employee, the ability to choose ANSI, REBA, RULA, the strain index, and why that's also important in this world, and especially, even working with ATI, is the idea that there's times where we can't get into a factory because we're not an employee, and with COVID, they're not going to let us in. But with an app-driven program that the employee can use their phone, or they can use a tablet or a laptop, we can now, in ATI and our other partners, can now coach the on-site employee on doing an assessment, not just of the individual, but doing an assessment of the environment, doing the assessment of a machine or a tool, doing the assessment of the actual job and task. And obviously I mentioned the employees. So we have 4 different layers of making sure that we're assessing them properly, attaching video, attaching images as well, to back up what this employee may not have a whole lot of training in ergonomics or safety, to attach those pictures as well to the report. So it gives you the ability to virtually guide them through. The nice thing is Healthy Working Pro also takes into effect that maybe you've completed a REBA assessment. And as it's completed, Healthy Working Pro recognizes that if you do one more assessment, maybe a strain index, or in the case of the UK, a MAC tool, it'll provide you with even much more accurate measures. So it actually kind of coaches you along and tells you, hey, maybe you want to use the Liberty Mutual lifting and lowering assessment to validate or provide much more accurate measure based on what you were able to score out of REBA, or maybe what you scored out of ANSI. So it provides a second layer of assessment in guiding your people on site, or even guiding you on site. And then it pulls all of that data together into our Healthy Working platform to allow you to have global risk all the way down. So I look at it in an HR world by person, place, position, right? So it gives you the ability to look at the forest and drill all the way down to the tree. No matter if the employee's in the industrial world, the factory world, non-office world, or in the office world, working remotely, working at home, maybe working in lab, all of the different ways and areas, environments that the employees can work in. So it puts it all under one platform for reporting purposes. I'm going to wrap up this talk. I think I've kind of come to the end. I definitely want to thank everybody for taking time to be on our virtual conference, our Connect Summit today in day 1. If you have any follow-up questions or concerns, we certainly are here for you. As Sheila had mentioned, she's happy to take questions. I'm happy to take questions, but we certainly hope that you enjoyed day 1, and we hope that you're able to join us tomorrow for another packed day of great information that we are definitely looking forward to sharing with you. Stephen, at this point in time, do I turn things over to you, or do I open things up for a Q&A session, or do we move on from here?
If there are any questions, then we can answer those. Otherwise, we can move on.
I think one of the things that, we hear at times is, what's the cost of the program? And I know, Sheila, you hear it as well. And initially when I heard that, my thought process went immediately to the e-learning.
And Sheila, probably on your end, your process went to, what does it cost to have a person on site? But a lot of times what I now recognize after talking to organizations, what they're worried about is the spend, right? They're worried about what type of equipment am I going to have to buy? Am I going to have to put in sit-stand desks for all my employees? Sheila, you're putting somebody at a factory. Do I need to replace all my factory equipment? They're looking at a much bigger spend out there. And what we want organizations to realize is, let's take advantage of what the employees have right now. Let's train them on what they have right now. And I do feel like at that point, and what we see in our data is by doing that, we can absolutely cut it down to 10 to 12% of the employees in high risk, and look at ways to provide value-based solution for those employees, as opposed to turning this into a procurement or a purchasing program. So I definitely hope that helps. Again, we're here for you. If you have any other questions, please let us know. If you needed to set up follow-up meetings or demos, we're happy to do that as well. So thank you, everyone. We really appreciate you attending today. Hope everyone has a great rest of the day.